Mental health has transitioned from being an overlooked issue to a defining global crisis that urgently demands our collective attention. Nearly 1 billion people across the world live with mental health conditions, representing a staggering 10% of the global disease burden, according to the World Health Organization, WHO. These statistics represent more than numbers. They represent lives affected, dreams delayed, and potential left untapped. This silent epidemic touches every corner of society, affecting individuals of all ages, genders, and socioeconomic backgrounds. It is a crisis of staggering proportions, and the cost of ignoring it is immense. The impact of mental health issues extends beyond the individual. Families feel the emotional weight, communities bear the strain, and entire economies suffer. Mental health conditions are now one of the leading causes of disability worldwide. According to the WHO and the International Labor Organization, the economic toll of mental health disorders exceeds $1 trillion annually due to lost productivity. Mental health is no longer just a medical issue. It is a fundamental public health challenge that affects every society and economy. The COVID-19 pandemic has only worsened this crisis. While the virus itself posed a physical threat, it also left behind an emotional and psychological toll that many are still grappling with. Isolation, fear, loss, and uncertainty have exacerbated mental health struggles worldwide. In 2020-2021, global cases of depression and anxiety surged by more than 25%. This is just the beginning. The long-term psychological effects of the pandemic will continue to affect individuals and communities for years, creating ongoing mental health challenges that we are only beginning to comprehend. Despite the widespread prevalence of mental health conditions, many people still do not have access to the care they need. In low-income countries, more than 70% of individuals with severe mental health conditions, such as psychosis, receive no treatment at all. This treatment gap is especially severe among vulnerable populations, such as children and adolescents. Currently, 1 in 7 young people worldwide suffers from a mental health condition, yet many of them will never receive the help they need. Barriers such as insufficient resources, unaffordable treatment, and the stigma surrounding mental illness prevent millions from seeking help. These gaps are not only human tragedies but also economic burdens that hinder societal progress. As WHO Director General Dr. Tedros Adhanom Ghebreyesus has said, everyone's life touches someone with a mental health condition. This interconnectedness highlights the truth that mental health is a shared struggle. It affects not only the individual but their families, friends, and entire communities. Just as we invest in physical health to support thriving societies, so too must we prioritize mental health. We cannot afford to remain silent. It is time for a global movement to address this issue with urgency. There is hope. The WHO's Special Initiative for Mental Health has made significant strides in reaching millions with essential mental health services, but much more needs to be done. Mental health must no longer be an afterthought. It must be integrated into every aspect of healthcare, social policy, and community building. Governments must step forward with the resources and commitment required to make mental health services accessible to all, regardless of income, location, or background. Healthcare systems need to be strengthened to provide equitable care, especially in rural and low-income areas where mental health resources are particularly scarce. In addition to systemic reforms, we must also work to create supportive, inclusive communities where mental health is valued. Stigma surrounding mental health must be dismantled so that individuals feel safe seeking help. Schools, workplaces, and local communities must foster environments where mental well-being is seen as essential to overall health, and those struggling with mental illness are treated with respect and compassion. We must create a world where mental health care is not only accessible, but celebrated as part of an individual's overall well-being. As individuals, we all have a role to play. We must stand in solidarity with those who struggle with mental health issues, advocate for better resources, and speak out against the stigma that still surrounds mental illness. Everyone deserves access to the care and support they need to lead healthy, fulfilling lives, and it is our collective responsibility to ensure this happens. Each of us can contribute to changing the narrative, offering kindness and standing up for mental health as a basic human right. The time to act is now. Every day we delay, the mental health crisis continues to deepen, and the suffering of millions escalates. Acknowledging the problem is only the first step. We must take tangible, decisive action to create meaningful change. Governments, organizations, and communities must come together to ensure mental health is no longer sidelined in healthcare systems. Funding for mental health services should be increased, with a particular focus on low-income and rural areas, where access is most limited. Additionally, integrating mental health services into primary healthcare systems will ensure that people don't have to seek out specialized care, making mental health support a regular and accessible part of healthcare for all. Education is one of the most powerful tools in combating mental health stigma. Schools and workplaces should prioritize mental health education and awareness programs. By starting these conversations early, we can build a culture of understanding that extends into adulthood. Mental health should be seen as a normal part of health, no different from physical illness. Promoting open discussions about mental well-being will help reduce the shame and stigma that often prevent people from seeking help. When we break the silence, we remove the barriers that keep people isolated in their struggles. On a personal level, we can all take steps to support one another. Small acts of kindness and empathy can make a world of difference for someone who is struggling with mental health issues. Listening without judgment, offering a shoulder to lean on, or simply checking in on someone can have a profound impact. It is essential that we remain patient and non-judgmental, encouraging those suffering to seek help without fear of discrimination. If someone confides in you, offer support, help them connect to the resources they need, and let them know they are not alone. Communities also have a vital role to play. Creating safe spaces for individuals to share their experiences can foster an environment of support and solidarity. Peer support groups, both in person and online, are invaluable in providing people with a sense of belonging and understanding. In addition, mental health awareness campaigns should be launched at the grassroots level to ensure that even those in the most remote areas are informed about the importance of mental health care and available resources. Everyone deserves access to care, and together, we can work to ensure that no one is left behind. Finally, prioritizing mental health means changing the way we view and approach wellness. Mental health care should be an ongoing, integrated part of our lives, not a reactive measure when things fall apart. Promoting resilience and well-being through regular self-care practices, stress management, and emotional intelligence can help prevent mental health issues from escalating. At a societal level, we must push for policies that promote work-life balance, reduce social isolation, and create environments that encourage personal well-being. We all have a shared responsibility in fighting the mental health epidemic, and each of us can contribute to building a healthier, more compassionate world where no one suffers alone.